Good afternoon, everyone, or good morning, wherever you are. Welcome to Sex Talk for Self-Advocates. My name is Anna Costalis, and I'm the Resource and Dissemination Manager here at AUCD. I'd like to thank you all for joining us today. Before we begin, I'd like to address a few logistical details. First, we'll provide a brief introduction of our speakers. Following the speaker's presentation, there will be time for questions. Because of the number of participants, your audio lines will be muted throughout the call. However, you can submit questions at any point during the presentation via the chat box on your webinar console. You may send a chat to the whole audience or to the presenters only. We will compile your questions at the end and address them. We may not be able to get to every question, so we might combine some questions. The entire webinar is being recorded and will be available on AUCD's website following the webinar. There will also be a short 5-question evaluation survey at the close of this webinar. We invite you to provide feedback on the webinar and also to provide suggestions for future topics. I will now pass the mic over to Julie Atkinson, the co-chair of AUCD's Sexual Health Special Interest Group, who will introduce our speakers.
Thank you, Anna. Hi, everyone. I am Julie Atkinson. I co-chair the Sexual Health SIG with Lindsay Molis in Kentucky. I am at the University of Alaska, Anchorage. We are excited. This is our third webinar in the series, and we have a great group of panelists who I'm going to go ahead and introduce, and we will get started and jump right into today's topic, which is sexually transmitted infections. So if we can go to the next slide. Our first panelist is Max Barrows. Max is an outreach director for Green Mountain SelfAdvocates, a position he has held since 2007. He mentors youth and adults with developmental disabilities to speak up for themselves and become leaders. Green Mountain SelfAdvocates is a lead partner of the SelfAdvocacy Resource and Technical Assistance Center, SARTAC. Max leads SARTAC's technical assistance team, assisting local and state self-advocacy organizations across the nation. Max connects people on all levels, advocating for true inclusion of people with developmental disabilities. In his work, he advances the message that when you are an individual with a disability, presume competence. He received a White House Champions of Change Award for this work in 2015. Max is an accomplished self-advocate from Vermont who serves as a board member of the Self-Advocates Becoming Empowered from 2008 till 2016. Our next speaker is Catherine McLaughlin. Catherine McLaughlin is a national expert and trains individuals, staff, and parents on sexuality and developmental disabilities. She teaches sexuality education to people with intellectual and developmental disabilities, as well as trains them to be peer sexuality educators themselves. Catherine is the author of an agency and a school curriculum entitled Sexuality Education for People with Developmental Disabilities, and has developed 2 online courses, one to train professionals, Developmental Disabilities and Sexuality 101, and one for parents, Talking to Your Kids, Developmental Disabilities and Sexuality. You can to contact Catherine, you can reach her at her website, which is www.elevateUstraining.com. And our last panelist is Erica Thomas. Erica Thomas is a health educator for the Developmental Disabilities Administration Health Initiative, housed at Georgetown University Center for Child and Human Development, a university center for excellence in developmental disabilities in Washington, D.C. She serves as a liaison between family members, healthcare professionals, and community providers that support people with disabilities. Erica develops and implements healthcare information curriculum and education sessions on a variety of wellness topics, including sexuality, for people with disabilities and their support teams. She's the faculty team leader and mentor of first-year medical students at Georgetown University, where she prepares future doctors to support and provide excellent health care for people with disabilities. Erica actively collaborates with state and local advocacy groups to deliver her message of wellness of the whole person. When she's not advocating for people with disabilities or promoting sexuality education in the community, she enjoys traveling the world and taking long naps. So before we begin, just a few things, just how we're going to set the stage, or so we're all kind of on the same level. Our panelists today, in speaking, they're going to use person first language. When the questions that they are going to speak to, we're using the words that came from individuals themselves, and certainly using medical terminology as we are discussing the topics related to sexually transmitted infections. During today's conversation, on our next slide, if at any point you feel uncomfortable or maybe you're reminded of a bad memory or something that had happened to you and you feel unsafe, there is the crisis call center that you can call, and they have trained counselors and professionals to help you. And the number is there on the screen. Lindsay, I think, has just put that into the chat box in the bottom. So if you, that number is there if you do need to reach out to someone today. The chat box is located at the bottom of your screen. If you guys haven't found that yet, there's a little icon with a little bubble with 3 dots. You can click on that and that'll open your chat box. And there you can send a chat to everyone, or you can send a chat privately to one of the presenters or to Lindsay. As we go throughout, as Anna said, you are welcome to add questions to the chat box. If you'd rather to send them to just one person more privately, you can send those to Lindsay Mollis. And you can just actually click on her name, and that will start a private chat. Instead of sending it to everyone, the default is for everyone. Before we go to our next slide, if you are in a location and you have more than one person attending, if you're with a group of people, if you guys wouldn't mind putting the number of people who are attending with you into the chat box, we just want to get a sense of how many people are participating with us today. So if you guys wouldn't mind doing that, we would love to hear from you.
Thanks a lot.
So how the webinar will work is that the questions that we're going to talk to, our panelists are going to talk to today, came from a survey that we have been collecting from self-advocates, questions that they have about relationships and sexuality. And there were quite a few that related to sexually transmitted infections, STIs. And so we felt that it would be good to spend today talking about those. Each of our educators are going to begin by addressing the questions, and the other ones might add some follow-up information. And as Anna said, at the very end, we will take time, we've set time aside to do question and answer and to follow up any questions that you guys have related to today's topic. All right, and with that, I am going to stop talking and I am going to turn it over to Max to get us started by talking about what is sexual self-advocacy and what does that mean. Max?
All right, thank you very much, Julie. Thanks for having me on here. So let's kicking things off as to the question, what is sexual self-advocacy? Well, the way I would put it is it has all the pieces of self-advocacy, and to break it all down, it has the piece of speaking up, being proud of who you are, learning new things. It's all about making your case, making decisions, learning from your mistakes. But the one thing you got to keep in mind with sexual self-advocacy is it can be more difficult than regular self-advocacy. Just to give you an example, just telling your boyfriend or girlfriend what movie you want to see is, a whole lot easier than telling a person what you want to do when having sex and what you do not want to do in that regard. Next slide. So, other examples of sexual self-advocacy are, feeling comfortable meeting people, flirting, asking someone to dance. Sexual self-advocacy means being free about your sexuality, like if you are gay or straight or lesbian. knowing how to deal with someone pressuring you to do something you don't want to do. One thing to keep in mind is, privacy is important. So, speak up for it. Knowing about birth control and safe sex, getting good information on those two things, and dealing with your parents when they don't agree, because people will go through that. If there's anything I missed, Catherine, if you would like to add anything about, safe sex or where to go.
Yeah, so I think Max, great job listing all these possible meanings of sexual self-advocacy. And the last one on the slide talks about knowing about birth control and safe sex. And today's webinar is going to be focused on safe sex, but that's a part of sexual self-advocacy, is knowing about sexually transmitted infections and how you can avoid them and how you can manage them, and also about talking about it, speaking up with your partner about whether you have a sexually transmitted infection or finding out if they have one. And using protection and getting tested are all parts of sexual self-advocacy and keeping yourself sexually healthy. So that's just sort of an intro into what we're going to do today. Next slide. So I'm just going to do a quick recap of the last webinar that we had, number 2. And if you didn't attend, I'll be showing you some links to the last 2 webinars. But this one, we talked about what is sex? What does that word mean? And we talked about how there are many different types of sex, and you can see listed on the slide, there's, solo sex, so sex with yourself, masturbation or self-stimulation. Also, rubbing sexual parts together or on other parts of the body is sex. Using your hands on a sexual part is sex. Also, oral, a partner puts their mouth on their partner's sexual part. Anal, where something's inserted into the anus for sexual pleasure. And penis in the vagina, sex. And there's lots of other kinds of sexual acts. And one of the things that we talked about was someone asked, what's normal? And really, there's no normal. It's really about whatever feels okay to you and your partner. That's what normal is. There isn't one way to have sex or be sexual. And part of being a sexual person is exploring this and figuring out what you like and don't like. So no one can tell you what's okay for you. Only you can. We also talked about how someone asked, is sex like it is in the movies? And what we talked about was movies are make-believe and people are pretending. And one of the things that happens in movies that involves sex is nothing bad happens usually. Sometimes, but lots of times no one has an unplanned pregnancy or no sexually transmitted infections. And so it's not real in that way. And also people are performing. So it's not real. And sometimes when people watch that, they think bad about themselves. They think they don't look like the movie stars. They're not having sex like the movie stars. And that sex really isn't like it is in the movies. So next slide. The other topics that we had were where should I have sex? What are the different types of sex toys and how do you take care of them? We also talked about orgasm and sexual pleasure. And then we just started to talk about safe sex. So that's where we were picking up from the last webinar. So what is safe sex and what does that mean? So the next slide, you can also see these are the 2 links to the last 2 webinars. So the first one, we talked about different kinds of relationships, and you can click on that link and hear the recording of the webinar. And then the one I've been referring to in the last few slides, number 2 is about sex and intimacy, and that one, you can click on that link and hear the whole webinar if you happen to have missed it or if you want to hear it again. Those are there for you. So next slide. And then I think Max is going to take it away. So one of the questions that we left off in the last webinar was, how do I have safe sex? And so we started to talk about getting consent. We talked about age of consent, whether someone's able to consent to sex. So we talked about those topics. We talked about how sex has to be in a private place. And now we're moving into sexually transmitted infections and protection, which is today's topic. But as you can, the thing is, as you can see on the slide, is ways to have safer sex. That we use the word safe sex. But the reason that I say safer sex is that you can do all the things that you're told to do to protect yourself, and you still could get a sexually transmitted infection. When you do all the things that help protect you, it makes it less likely that you will get one, but you could still possibly get one. And that's important for people to know. It's safer to use all these things, but you could still get one. So an example is you could use a condom to protect yourself from and still get a sexually transmitted infection. One way that infections are spread is from skin-to-skin contact, so skin touching each other. So the condom may not cover all the skin, and you could still get an STI, or sexually transmitted infections. Condoms help and make the likelihood of you getting one much lower, but you could still possibly get one. And when I was first an educator, I used to say, oh, just don't have sex or use a condom. And we didn't realize that you could still, even if you used a condom. So Max is going to talk to us now about what is a sexually transmitted infection? What do these words mean? Take it away, Max.
I will take it away. All righty. So what is an STI? Of course, it stands for sexually transmitted infection. And you want to know what sexually transmitted infections are. They are caused by many different germs. So, you know, if we were scientists, we could spend all the afternoon describing all the different germs and viruses and bacteria involved, but we're really here to talk about sex. So let me just say these germs are invisible and small, and they can make you sick. You know how you can catch a flu from someone? Well, you know, this is, you know, similar, but much more serious. You can get a sexually transmitted infection by having sexual contact with someone who already has, you know, an STI. So if you're having sex, just make sure to see your doctor and get tested for a sexually transmitted infection. What I found is there are lots of myths about STIs getting passed around. You know, some people say, well, if you take a shower after sex, you know, will be safe. Well, you know, that doesn't work. So today we will talk about the different kinds of sexually transmitted infections, you know, and what you can do to avoid getting sick. Next slide. So, you know, if you're wondering what the difference between, you know, a sexually transmitted infection, STI, and a sexually transmitted disease, STD, there's really no difference between the two. They mean the same thing, and either one can be used. So all mean the same thing. Lots of people, they use the word infection because they have found that when you use the word, that particular word, people aren't as afraid or, you know, concerned if they, you know, get one. You know, when you say the word disease, it's much, you know, it sounds scary. It's pretty terrifying to some people. Next slide. So, you know, people wonder, how can I get a STI, sexually transmitted infection? You can get an STI when you're having sexual contact, with another person. By sexual contact, I mean putting your mouth, hands, or genitals on, the genitals of the sores of someone who is infected. And also, you don't have to, go all the way, quote unquote. These are a few, there are a few STIs that are spread by skin-to-skin contact. Next slide.
Well, I think that's me, Max.
Yeah.
Did you have anything else you wanted to add?
I do not.
All righty. So first, just want to say hi to everyone, and it's good to see you all. And the question that I'll cover is, how does a sexual disease make you feel? So just like Max said, so when we say STI and STD, so when we say sexual disease, it means the same thing. So how does it make you feel? Sometimes you might not feel anything. And then if you feel or see something that's not normal, it may mean you have symptoms. And so you might ask, what's the symptom? So if you find that you've had sex with someone and different parts of your body don't feel right, or something doesn't look right, then it's important that you let someone know. So you want to tell someone you trust, and you want to make sure you have the conversation with your doctor as well. So down here at the bottom, we have an example of a symptom. So having a rash on the palm of your hands or the soles of your feet, or on your torso, or like around your upper body, that is a symptom of syphilis, for example. So if you see that and that doesn't look normal, and you had sex with someone, then it's good for you to go and have a conversation with your doctor about that, because that's not normal. Can I have the next slide, please? And then again, so more symptoms, or how a sexual disease may make you feel. So there may be discharge from the penis, the vagina, or the anus. So the discharge can have a color to it. It can be yellow, it can be green, it can be white, it can look a certain way. So it can be, for example, a woman may have something that looks like cottage cheese coming from her vagina. So if that's not normal, then again, you need to have a conversation about it with your doctor. Itching or burning in the anus or genitals, pain with sex, pain and or burning when urinating, bumps or sores that can be painful and or itchy, anal pain or pain when having a bowel movement, vaginal odor. So the vaginal odor may be a fishy odor, body aches, bleeding between periods, pain in the testicles, fever, headache, swollen lymph nodes, fatigue, and abdominal pain. So those are some symptoms in this, and these again, like might be how you feel. So if any of this is not normal, then you need to have a conversation with someone. So even you might want to start when you go to see your primary care doctor, or ladies, when you go to see your gynecologist, you can start to have these conversations with your doctor, things about your body, so that you can get to know your body and know what's normal for you. Next slide, please. So these are just some common STDs or STIs. And so how Max was talking about different bacteria and viruses. So here for chlamydia, gonorrhea, and syphilis, those are bacterial infections, and they can be cured. So you can take an antibiotic for those particular STDs, and you can get rid of them. Your body, you can take those antibiotics and you can get rid of them, and you won't have them anymore. And then when we had talked about skin-to-skin contact with certain STDs, so herpes and HPV, for example, are spread by skin-to-skin contact, and those two, they cannot be cured. So you can take medication to lessen your symptoms. So when we had just talked about symptoms, so if there's itching, if there's burning, so you can take medication that will make you feel better, but you can always pass those two diseases to your partner if you're having sex while those symptoms are present. And then, so we have some symptoms at the bottom. So again, like chlamydia and gonorrhea, how it says in the box, like you may not have any symptoms. But if you do, it may be, again, you can see on the side the different symptoms that can occur. if you don't go and get yourself checked out, it can turn into, for example, for women, infertility, which means you can't have children. So if you're looking to get pregnant, you and your partner, then you may not be able to get pregnant if you have an STD that you didn't go to talk to your doctor about. So again, make sure that if you don't feel right or if something doesn't look right to you, that you go to your doctor and have that conversation. Next slide, please. So here's another slide about how long before common STD symptoms appear. So again, remember how we said some symptoms may not appear. So this is just kind of like a rule of thumb. So for example, you talked about gonorrhea. So that can show up between 2 and 30 days. So a month from now, you might feel burning or irritation, or, you know, when you go to the bathroom and things like that, and that could be from gonorrhea. So if those symptoms come about, you want to make sure, again, that you go and talk to your doctor. So you can go through these at your leisure and take a look at these. Next slide, please. All right. So then what happens if you happen to get an STD? So often when people get an STD, there's this stigma around the person. And, you know, the person may think that I'm dirty or that I'm a bad person because I contracted an STD. And let me tell you that you're not. A lot of people have STDs. A lot of people have unprotected sex. A lot of people go through this exact same thing. So you're not a bad person. You're not a dirty person. You're none of the above. You just are a person with the STD, and you should go and get yourself checked out. So if you think that you may have an STD, you want to talk to someone you trust about what's going on with your body. You want to go to your doctor or go to a clinic to get tested. So when you go to the doctor, you will get an STD test. So that might mean a blood test, a urine test, or a fluid sample. So a blood test, they'll take blood, you know, give you a shot, take blood from you. A urine test, you'll go and you'll urinate in a cup, or a fluid sample. For example, when you have a pap smear, ladies, when the doctor goes in and swipes inside of your vagina. So that will be an example of a fluid sample. If you have an STD, you have to tell your partner. So Max had said before that, you know, it's not the same as having a conversation about, okay, so what movie do we want to watch? This is a very serious conversation that you need to have. So if you have an STD, you have to tell your partner, and then that means that your partner will have to go and get tested as well to make sure he or she does not have the STD. Or if he or she does have the STD, to get proper medication, and also that you two can continue your wonderful sex life. You want to make sure that you're taking all of your medications. So maybe by like day 3, you know, it doesn't burn when you urinate anymore. But if your doctor tells you that you need to take this medication for a certain amount of time, and for a certain number of times per day, you want to make sure that you take that medication as prescribed by your doctor to make sure that the bacteria and all is out of your body. While you're taking your antibiotic or your medication, you want to make sure that you're not having sex, because what happens is the virus or the bacteria and all is still in your body. And so if you're taking antibiotic, yes, the antibiotic is fighting what's in your body, but you're still passing that disease back and forth between you and your partner. So you can take a break from sex for a week or so, and you two can do other things, and but just no sex. But again, talk to your doctor about what you can and cannot do while you're taking your medication. And then once you finish your medication, if you still have any symptoms, you want to make sure that you have a conversation with your doctor, because your doctor may need to prescribe something else or do another check just to make sure. Next slide, please. Okay, so again, so what happens, what do you do if you get an STD? So you might want to, before your appointment with your doctor, you might want to write down any of the symptoms that you're experiencing. So that way, when you have it on paper and you wrote it down, when you go in, you can read from your list, because you might get nervous or whatever, or you may forget some of the things that you want to tell your doctor. So you can write down any symptoms or the way that you feel. You want to make a list of the medications that you're currently taking. And then you may want to write down some questions to ask your doctor as well. So just an example, what is the name of the infection or infections I have? How is it transmitted? Can I catch it again? You know, et cetera. And then also, you may want, just in case you get nervous, you may want to practice with a friend or a family member or someone that you trust, and you can ask these questions back and forth. Or if you're a little shy about it, then you can practice in the mirror with yourself, just so that you're comfortable with being able to ask the questions and being comfortable with having a conversation with your doctor. Next slide, please. So again, of course, when you ask your questions, your doctor will have answers for you, and then your doctor may have questions for you as well. So be prepared for these questions, because your doctor may ask you how long you've had the symptoms, if you're sexually active with men, women, or both, how many partners you have, how long you've been with your current partner, if you've used drugs with someone, or if you use drugs, if you've had sex with someone who's injected drugs, what type of protection you use, the number of sex partners you have, how many people you've had sex with in the past couple of months, and when was your most recent sexual encounter. So again, if you're nervous, or you want to practice, then practice with someone you trust, or again, practice in the mirror with yourself. Next slide, please. Okay, so we had talked about different medications. So the question is, what are the medications for sexual diseases? So again, like we said, bacterial infections like gonorrhea and chlamydia, you can take an antibiotic and you can be cured of that particular STI, again, if it's used properly. So if the doctor tells you to take it for, X amount of days for, X amount of time, then you have to make sure you take it as prescribed. So antibiotics can cure many sexually transmitted bacterial and parasitic infections, including gonorrhea, syphilis, chlamydia, and trichomoniasis. So again, when you start this treatment, take all of the medication that's prescribed. And like we said before, no sex until you're done with the treatment. And in the case of a viral infection such as herpes, you want to make sure that those sores are healed. Next slide, please. Again, so then the other type of medication is called antiviral drugs. So those can relieve the symptoms of the virus, for example, in HIV and herpes. But remember, you always will have that infection in your body. So even though you don't have symptoms, so even though you don't see blisters, or even though you don't see anything on your body, that virus is still in your body. So when you take these medications, it'll make you feel better, but you can still pass the virus to someone else. So for example, the drugs can keep HIV infection in check for many years, fewer herpes reoccurrences. They lessen the risk of infection, but again, it's still possible to give your partner HIV or herpes. And like we said, you will always have the virus, and it can be transmitted to your partner. And then just keep in mind, so once you get tested and your doctor tells you that you have a viral infection, the sooner you start treatment, the more effective it is. So if you're told that you have HIV, you want to start taking your medication as soon as possible. And then again, that's going to make you feel better. And then it'll lessen the virus in your body. But again, you can still transmit the virus. Next slide, please. All right. So then there are vaccines. And so the CDC has a part on its website, and it discusses what vaccines are available for STDs. So there's hepatitis B, hepatitis A, and HPV that are available. So basically, it's the same concept as a flu shot. So I know many of us get flu shots. So you'll get the flu shot, and when you get it, the virus is introduced to your body. Then your body builds up antibodies against this particular disease that's injected into your body. And so your body is actually fighting this disease, and it's learning how to fight this disease. So if you come in contact with it, then your body will automatically know what to do, and it's programmed to fight this disease. So if you choose to get these vaccines for hepatitis B, hepatitis A, or HPV, it will protect you from the STDs above. And then you'll get it by a shot in your arm. And when you get a shot, same thing as a flu shot and other shots, your arm might be sore. But just in case you're concerned, you can have the conversation with your doctor to first of all see if it's right for you, and then if you do get it, to ask about side effects or what can potentially happen to you. Next slide, please. And then I wanted to leave you with this. A lot of folks haven't heard about a medication called PrEP. And this medication is for people who are HIV negative, but are in relationships with people who are HIV positive. And what PrEP is, it's an antiviral drug that you can take every day, and it will reduce the risk of you getting HIV. So if you have to be HIV negative, which means you do not have HIV, and your partner has HIV, or your potential partners may have HIV. So it's another added layer of protection. And so again, if you're taking this medication daily, which you have to take it daily in order for it to work, If you use condoms, it can lower your risk even more. So just taking the medication alone will put you at about 90% of not getting HIV, and using condoms can boost that number even more. And then if a dose is missed, the level of HIV protection may decrease. So this is something that's relatively new on the scene. I live here in Washington, D.C., and we have on the side of our buses at bus stop stations and like all around the city, we have signs going up about this. So people are starting to ask questions. So if this is something that you're interested in, by all means, you might want to do some research on it, or, you know, start looking into it for your life. All right, I think that's it for me. Yeah.
Great job, Erica. Alrighty. So now you want to know, how do you ask your partner if they have an STD, sexually transmitted disease? And just to keep in mind, this is a question that you want to ask your partner before you have sex. So you may be wondering how to go about this, and I will tell you. What I would do is I would start the conversation out by expressing that this is a topic that's going to be difficult to discuss, but the reason why you're doing it is because, you know, you care about the health and well-being of the both of you. And you also want to check with your partner first, and maybe start out by asking them, do you know what an STD is, or have you heard of one before, or heard that term? And, you know, I ask because this is what I would, you know, like to talk about with you. So, you know, just keep that in mind. And you also want to just keep in mind too that you know, the questions are going to be, you know, kind of sensitive at first, but just say, like, I have to ask, then ask the question, like, do you have an STD, or have you been tested for an STD recently? And then do this in your own words. Just make sure that you set a comfortable environment for, you know, this to be talked about. And if you really want to make it less nerve-wracking for, you know, your partner, you can also in the conversation just say, hey, you know, feel free to ask me. So it could ease the tension even more. Next slide, please. So we just talked about asking your partner if they have an STD and whether or not they've gotten tested. So telling your partner that you have an STD can be just as, if not more, you know, uncomfortable, or as I would put it, nerve-wracking. So to ease the tension, here are some tips that we have. You know, first things first, make an appointment and get tested to your local clinic or doctor. It's important to get the facts. In other words, you know, get the right information that is the most reliable. You know, tell your partner whether or not you have an STD or STI beforehand. Same thing. Next slide. If there is a next slide. Oh, yes. And I was kind of going through this, but I'll continue. Figure out how you want to, like, go about telling your partner that you have an STD, and figure out if you want to do it in person or in another way. And what I would do is I would, you know, kind of figure out how to go about that by planning what you want to say and how you're going to say it. That would help me out a lot if I were in this situation. And you could do this by practicing like in the mirror or with a friend, or however you want to practice that is comfortable to you. And when you begin the conversation, tell them that it is important to me because I care about our, relationships, health and well-being, or just I care about being safe and healthy in our relationship. Prepare yourself for how, your partner may respond by thinking about what they could say. And then all of this, going through all of this, when completed, take a deep breath. If you want to, look in the mirror. Be proud of yourself. Pat yourself on the back and tell yourself you did it. Nice job. You will feel so much relief when, the weight of this is all off your shoulders. And now, if, Catherine, if you have anything that you would like to tell us about protection and safe sex.
My phone just started ringing. Sorry, everybody. It never rings. So thanks, Max. I am going to talk. One of the questions that we got was how to protect myself when I'm a female and my partner's female. So there's this myth that if two females are together, that you can't get a sexually transmitted infection. That's a lot of rings, isn't it? All right, let me just give it a second here. Yes, okay, there we go. Sorry, everybody. So it is a myth if two people that have female sexual parts, they have a vulva and a clitoris, are sexual together, you can get a sexually transmitted infection. So it's a myth. The truth is that you can. It may not be as risky as some other sexual behaviors, being with two women or two females, but you still can get one. And like we said already, it can be skin-to-skin contact. So you could be rubbing your sexual parts together, vaginal fluids, menstrual blood, and sharing sex toys. So there's ways to avoid getting a sexually transmitted infection when it's two females together. And these are things that people do all the time as far as protecting themselves. So it's not just for females, but I'm going to tell you about that a little more specifically. Next slide, please. So how someone would protect themselves if they have female sexual parts, they're with a partner with the same parts. You can use a dental dam, and really a lot of protecting oneself against sexually transmitted infection is to create a barrier. So putting something between the bodies, right? So a dental dam, you can see in the bottom corner are some pictures of dental dams, and they are something that's used when you go to the dentist, but they're also used to protect you from skin-to-skin contact with someone or the fluids. So that's put over the vulva for oral sex, and so someone has a barrier between their mouth and the vulva. You could even use a dental dam if you were rubbing your vulvas together. Also, manual sex, you want to wash your hands before and after. You could also use latex gloves, and you can see some pictures down below on this slide as well. So also female condoms, and I don't have a picture on this slide, but on the next one I do. You can use a female condom to create a barrier as well. And the female condom is different, and it goes inside the vagina, where the male condom goes on the penis. You can also use, you can see this other picture of these little finger cots as a way to protect, create a barrier between the sexual parts and the person's hand. Using sex toys you want to wash them before and after. And if you're sharing them, sometimes people will even put a condom on it just to be sure that if there's any of the germs on the sex toy that it doesn't touch the skin or the body. Next slide, please. So really, how to avoid. Well, first, I also wanted to say, when we talked about how you can get a sexually transmitted infection, sometimes people think that like their sex life is over then, and that, you know, that's it. And people have sexually transmitted infections, live with them for a long time, and have healthy sex lives. So you don't have to feel like it's, you know, the end of it if you get one. Some go away, and the ones that you can't get rid of, people live very healthy, happy lives with them. So Max already mentioned that they're passed through oral, anal, vaginal, sometimes even the rubbing of sexual parts together. We kind of talked about passing fluids or skin-to-skin contact, or the ways that they're passed from one person to the other. It's also important to know that you can't, just by having sex with someone doesn't create a sexually transmitted infection. One person has to have one in order for you to get it. So just like if someone has a cold and they sneeze on you, you can get it. But if no one has a cold, you're not going to get a cold from that person. So that's how they're passed. And sometimes people don't actually know they have one, because I think Erica mentioned sometimes there's no symptoms at all. So you may not even know it and be passing it. So getting tested regularly is part of staying healthy. And then you'll know. So you can have those conversations that Max mentioned about, I have one, this is what we can do to reduce spreading it to you. But if you don't know you have it, then sometimes people pass them accidentally. So it's important to go get tested. There's nothing to be ashamed of to go and get tested. It's recommended to go once a year, or if you have a new partner, you want to get tested. The other thing that I wanted to mention too, and then we'll move on to questions, I think pretty soon, is I think we've kind of talked about this a little bit, that sometimes people with disabilities, maybe doctors or people in the world, don't think that people with disabilities are sexual, right? And we know that's not true. That's a myth. The truth is that everyone is a sexual being. So sometimes if you feel like, geez, maybe I do have something, and my doctor is acting like, well, you could never have a sexually transmitted disease. You're someone with a disability. You don't have sex. You might have to educate them a little bit so that they can get rid of the stereotypes that people with disabilities are not sexual people. So that's another part of sexual self-advocacy, is speaking up with your medical provider when you feel like they're not thinking of you as a sexual person. Next slide. Right, so we kind of talked about this when we talked about two females, but there's male condoms, and you can see there's a picture on the right. There's different colors and flavors, and then there's a picture of how the condom goes on the penis. And then the picture up above is the female condom, and you can see there's kind of a ring in the middle of it, and that goes inside the vagina. And so it covers the walls of the vagina. So using a barrier, like I mentioned before, a condom, dental dams for oral sex on a penis, flavored condoms, rubbing sexual parts together, a dental dam, I mentioned that already, washing hands, sex toys, we talked about all of that. So that's the way to avoid them, is creating a barrier. But also, similar to what Erica talked about, that there are some medicines that you can take that will make it harder for you to pass it to your partner too, if you have a virus. So that's another way, is to find out about those medicines so that you don't pass it on to someone else. Next slide. Yeah, so I think we're down to the question part. I don't know if Erica or Max have anything to add quickly before we start questions.
I don't. But
Bring
thanks for
on the
asking.
questions.
Hmm?
I said, bring on the questions.
Oh, bring them on. Yes.
So if people have questions, please go ahead and type those into the chat box. Or Lindsay, did we have any that came in that our speakers could answer for us?
We have not had any questions in the chat box yet. So if there's any that you want to ask anonymously, you can click on my name and I will happily ask them for you, or this is the opportunity for you to unmute your mic and ask our panelists questions regarding our topic or any topic specific to what we've talked about even previously. And we're here for you all for the next 10 minutes to answer your questions.
Can I just add something that I was just thinking about? And Erica brought it up, that sometimes people feel ashamed or they feel like they're dirty or bad because they have a sexually transmitted infection. And I've known people that didn't even share with their best friend that they had gotten a sexually transmitted infection because they felt so ashamed. And the thing with that is that then we don't know that these things happen if we keep them really private. Now, it doesn't mean you tell everybody in the world about it, but people that you're really close to, it's okay to talk about it, and they'll be there to support you and help you feel better, and maybe go to the doctor with you or something. But there's a lot of shame around getting a sexually transmitted infection, and really it's just like a skin infection. It's just an infection. And I just think it's important for us not to feel bad, because when we feel bad, then we don't tell anyone, then we don't get the treatment we need, and then we might pass it on to someone else. So.
Absolutely. And one of our questions that's come in is asking, what should you do if your partner refuses to talk about protection?
It's a good one.
That is a good one. And if anybody wants to start that one.
I think some people might not want to talk about it because they, like if you brought up, can we use protection? They feel offended that you thought they might have one, or and so sometimes that's why they don't want to talk about it, and they feel like you're like insulting them or something by bringing it up, but you're really not. Like Max said, you're caring about their health and your health. But sometimes people feel, hurt that you brought it up. So that can be the reason. And you could always say, this is for both of us, to protect both of us. I'm not saying you have one or you don't, but sometimes people have them and don't know it. So it's just for both of us, So that's what I would say to find out, why they're refusing. Maybe they're allergic to condoms.
They don't know.
Maybe they don't know.
Yeah.
Maybe they don't know, and maybe they're embarrassed to even try and give it a guess. I would probably, if that's the case, maybe recommend, or maybe if they're ready to do you want to go maybe to your doctor or local clinician to get more information? We could go together. I could go with you. You really never know why somebody refuses at first to, talk about, protection.
And then I'll just add, when with this question, if someone is refusing to use protection, it's your body, and you have to protect your body and protect yourself. So again, you're not automatically saying that someone has a disease, but above all, you should be looking out for yourself, and you want to protect yourself.
Yeah, and also people may not know they have one too, so you might as well use protection just in case you do. Sort of like wearing a helmet when you ride your bike. You don't always fall and hit your head, but you've got it just in case.
And then like Max said, when you all go and get tested together, or you go with the person, or the person brings you their paperwork or whatever, then that's another conversation that you two can have to decide whether or not you want to use protection. But again, both of you have to be STD disease free in order for that to happen. And again, that's a conversation that you all will have to have after both people have been tested.
Mm-hmm.
I have a question.
I heard someone speak up and say they had a question.
Yeah, this is Brian.
Oh,
I just
hey.
wasn't sure if I'm supposed to click something to raise my hand or put my hand up or how that works.
Yep, you're good. We can hear you. Ask away.
Excellent. I'm wondering what kind of situations have people been in where you actually felt comfortable to have the kind of conversation that we're having now? You know, now you can be, you can block off your video. You don't, somebody doesn't have to know your name. And it's kind of in a stranger, anonymous way. But how do you, what are some of the experiences people have had with having some of these real conversations? I'm curious about the culture, even if it's just two people or if it's larger, where they can have real sex talks. Feel safe to do that.
You know, I think it's like what makes people feel safe to have those conversations? Like you're saying, in this situation, sometimes it's safe because you can just type in the question and no one knows it's your question. But I find that when, you know, you have a class of people and you close the door and you set like ground rules or group agreements about not being judgmental and listening and supporting one another and not making fun of each other, people really want to talk about this, and they will. I mean, there's a lot of people that want to talk about this, so if we can create different safe places for people to talk about it, people will.
And then I'll add to, from my experience with working with folks, it's a very personal topic, and as you know, and a lot of times people don't want to have the conversation. So when I go in and talk to someone, it may take, you know, 5 times for me to see that person in order for them to open up and to have the conversation with me. So again, I think creating a safe space to have those open and honest conversations. I think giving people accurate information, not sugarcoating things, using correct terminology, not using nicknames and things like that, but just being direct with people. And then just, like I said, being open and honest about answering questions for folks. And the biggest thing I think is just being patient. And usually people come around and they'll start to ask you, their interest will be piqued somehow, some way, and then you can kind of, you know, take it from there.
Thank you, Erica. I agree. What's the situation where you get to be patient with someone and see them maybe 5 times to where then it opens up?
So with the work that I do a lot of work in the community. So I go to people's homes. And so I may set up a visit on a Tuesday and go and talk to someone for 5 minutes and just shut off. I don't want to talk about it. I'm done. And then, you know, well, can I come see you next week? And it's like, okay, sure. So then like next week I might get 10 minutes. So it's just a process of like building up the person's confidence to have the conversation with you. And then, like Catherine said, you're not judging anyone. You're not making fun of anyone. I just want people to live their best sex lives. And I tell people that all the time. Like, I want you to be healthy. I want you to be happy. And I want you to be able to live your life the way you want to. And so I always lead with that message. And so usually I can get people to open up to me. And usually, like I said, if it takes time, if it takes me 10,000 times, it'll take me 10,000 times to do it.
Thank you, Erica. This is Julie. I just want to go to our next 2 slides. Our next slide, we have a few resources that our panelists had put together. One is from the Mayo Clinic, and there it's just a discussion of different sexually transmitted diseases. And there's also the CDC website on PrEP, so a little bit more information that Erica had introduced to probably many of us today around PrEP. I do want to thank Erica, Catherine, and Max. They are absolutely fantastic. I love having them doing this series with us because they keep it real, but they also create a really, I think, a great environment for us to be able to have these conversations. So that being said, our next slide, coming up, we already have been talking about the things that we're going to be talking about. Oh, I put the wrong year on this slide, you guys. 2019 and 2019. So in February, just before Valentine's Day, we are going to do our next, our number 4 in the series, and we're going to do relationship experiences, and we're going to have be working with self-advocates about their relationships, and then speaking to, this is what my relationship looks like, this is my experience, and answering some questions again that have been collected through our surveys. And so I think it'll be a great one where we could talk about positive aspects of relationships, whether they be from someone who is single, someone who's married, someone that's in a dating relationship. So hearing lots of different perspectives about relationships. So that's what's coming up. And as soon as we have a registration link, we will get that sent out to all of those who have been attending the Sex Talk series. So with that, Anna, anything else to close out? I see that you put the survey link out there.
Yes, I just want to thank again our presenters for presenting today for this awesome topic. And the webinar will be archived at the AUCD webinars library, aucd.org, probably by tomorrow afternoon if you take a look. But I'll also send the link out to all registrants. I put a link in the chat box. You can take a few minutes to fill out 5 short questions to give us feedback on the webinar and also to provide a suggestion for future topics. Well, and thank you again, and I guess have a great rest of your week.
Thank you.
Thank you all. Take care.
Hey, have a good day. Bye-bye now.